Good evening. My name is Addison Lasserre, and today I will be presenting about pediatric diabetes in African American populations, why the health of small people can make a big difference. As we've discussed in the coursework, African American individuals face a disproportionate amount of barriers to access to healthcare and consequently face increased risk of certain health issues. African American individuals are twice as likely to be uninsured, even though 8 out of 10 are working families, according to National Healthline. Racial differences in socioeconomic status, neighborhood residential conditions, and access and proximity to care can all contribute to psychological stress, which is directly linked to poor health outcomes. In a journal article by Libnan and Arslanian, it has been reported that there is a rapidly increasing prevalence of diabetes in pediatric communities, particularly among African Americans, Hispanics, and Native Americans. Furthermore, they found it to be increasingly caused by diabetes 2 mellitus, which is often linked to increasing rates of obesity. So first, we must ask, how much more is diabetes affecting African American children compared to the entire population of children? Well, a study from the American Diabetes Association found that type 1 diabetes has a prevalence of 0.057% versus the 0.022% average for the general population of pediatrics. This indicates that African American children are nearly 2.6 times more likely to be affected by diabetes as a child. Though these percentages affected may seem small, an early diagnosis of diabetes can cause many health complications for children, including increased risk for blood pressure and risk for heart disease, nerve and kidney damage, and increases risk for potentially deadly diabetic ketoacidosis, where a lack of insulin causes the body to break down fat too quickly and produce too many ketones, leading the blood to become deadly acidic, according to the Mayo Clinic. Children in African American populations face extraneous barriers to care and extra risk factors that make treatment and management of their diabetes more difficult. A literature analysis of data on pediatric diabetes in African American populations found that there are 5 significant risk areas that contribute to increased prevalence and decreased self-management skills. These factors include interactions with others with diabetes, parenting skills, perceived lack of normalcy with peers, negative school and home influences to diet and exercise, and adolescent developmental issues such as parent-child conflict and desire for instant gratification. We know that there is this health disparity, but how do we work towards a solution to the problem and prevent further complications? Well, the American Diabetes Association recommends that once a child reaches ages 8 through 11, they begin to transfer responsibility to being responsible for their own diabetes care. However, without proper training, their diabetes can go unmanaged and complications occur. Providing educational resources and community trainings for children suffering from diabetes at their school can help them learn proper techniques for administering and monitoring their insulin levels. Furthermore, children should have access to reduced cost insulin despite their insurance status, including an option to have it delivered to their home to cut out any transportation barriers in getting their necessary medications. Lastly, encouraging parental involvement and support, such as working on daily glucose logging charts together, can help promote better care and maintenance of diabetes. Now for discussion, I ask, should there be government subsidization on additional tools to help increase and maintain better diabetes care for children? For example, automatic glucometers and automatic insulin pumps? These are my references, and thank you so much for listening today.